Welcome, welcome everyone. Welcome to tonight's Acts 2 workshop, Dementia Caregiving and COVID-19 Moving Forward. I'm Dr. Robert Glukov, servant leader of the Acts 2 project and professor at Florida State University College of Medicine. In case you are unfamiliar with the term Acts 2, it stands for African American Alzheimer's Caregiver Training and Support Project 2. Folks, I am excited about this timely and important workshop. You will have an opportunity to learn about the recent scientific developments in preventing and treating COVID-19 and equally significant community reservations about vaccination. Audience participants are strongly encouraged to provide input and ask questions about these issues. Before I introduce this evening's presenters, I want to recognize our partners who have contributed both resources and guidance in the development of the Acts 2 Dementia Caregiver Workshop series. The Acts 2's primary collaborators are the African Methodist Episcopal Church, 11th Episcopal District, the Florida State Primitive Baptist Convention, Florida Progressive Missionary and Educational Baptist Convention, Florida General Baptist Convention, and FSU's College of Medicine REACH Project. Turning to tonight's presenters, we have four dynamic speakers: Dr. Joe Brown Spates, Miss Brenda Franks, Mrs. Lisa Bretz, and Mrs. Tamika Norton-Brown. I have the privilege of serving as moderator for the evening's workshop. Please permit me to share just a few words about each of our distinguished presenters. Our first presenter, Dr. Joe Brown Spates, is chairperson and professor, family medicine and rural health at Florida State University College of Medicine. She is also senior co-pastor of University Ministries International. Dr. Brown Spates is the 2018 recipient of the FSU Dr. Martin Luther King Jr. Distinguished Service Award and a 2017 fellow of the George Washington University Leaders of Health Equity International. Dr. Joe is a powerful spokesperson promoting the healthcare needs of the Black community and serves on COVID-19 task forces both at FSU and University Ministries International. In her limited spare time, Dr. Joe enjoys taking long walks with her husband, Gregory, listening to music, and swimming. Our second presenter, Miss Brenda Franks, is president of Sun City Events and Entertainment, a family-owned and operated business that produces and manages concerts, tours, and festivals. She is also president of Jacksonville Sister Cities Association Board of Directors, where she coordinates relationships between Jacksonville and 8 international cities across 8 different countries. Ms. Frinks was primary caregiver for 2 dear family members with Alzheimer's and is a trained Acts 2 facilitator. Her favorite fun activities include gatherings with friends and family, traveling, and cultural explorations. The third presenter, Mrs. Lisa Bretz, is executive director of the Area Agency on Aging for North Florida, which is now doing business as Advantage Aging Solutions. She is responsible for the oversight of day-to-day operations and coordination of services for elders across a 14-county area. Lisa received her master's in social work degree from Florida State University. In addition to her role as executive director of Advantage Aging Solutions, Mrs. Brett serves on the board of trustees for the Florida Council on Aging and is vice president of the Florida Association of Area Agencies on Aging. Note that Lisa was the primary caregiver for her dear mother with early onset Alzheimer's. She created the Cheryl's Hope Project in her honor. In her limited spare time, Mrs. Bretz enjoys spending time with her husband and family, weekly Bible study, and drinking nutritious coffee beverages. Perhaps Tamika Norton-Brown is project coordinator of the Acts 2 project. She has worked in the area of survey development and evaluation for over 21 years. She has served herself as a caregiver for her dear aunt and uncle with dementia and has a passion for helping others. Tamika has been a great source of encouragement and support for literally hundreds of family caregivers of older adults with dementia across Florida. She is also a strong leader by example in her church community. During the course of the workshop, folks, I encourage you to share questions to be answered after each presentation using the text message function of Facebook Live. We will also have 15 minutes for question and answers following the last presentation. And now we have Dr. Joe Brown Spates.
Thank you, Dr. Glukoff.
Welcome, Dr. Joe. We are both privileged and delighted to have you back.
Thank you.
At the Acts 2 workshop. We know that almost a year ago, you presented on COVID-19, and we asked you to come back this evening to talk about dementia, caregiving, and COVID-19 moving forward.
Yes, yes. No, I appreciate so much the opportunity to be here with you.
Well, we're delighted.
Thank you so much. Should I get started? Awesome, awesome, awesome. Well, hello, everyone. It is just a privilege to be here. I'm so honored to have this time to share with you again. And I look forward to the dialogue and also sharing this space with the rest of the panelists. So I'm just going to begin by talking about dementia caregiving, COVID-19 and COVID-19 moving forward. And I looked back on the slide, and it's so interesting to see how much has changed and what's happened since last year when I presented and I was with you all. A few COVID-19 updates, just to summarize. There's new variants for COVID-19, namely the Delta variant, as most of you have already heard about. There's been a reversal in the downward trajectory recently of the COVID-19 cases in the last month and a half or two. A rapid and alarming rise in COVID-19 cases and hospitalizations. We know that the Delta variant that has been the most prominent variant has also been more infectious and leading the infections, most of the infections these days. There's an urgent need to increase vaccinations because we know vaccinations prevent hospitalizations and help prevent death. Also, everyone should wear a mask in areas of substantial or high risk, according to the CDC, high risk of transmission, even if fully vaccinated because of the Delta variant. There's also new evidence about the safety of COVID-19 vaccines and recommendations for those 12 and up, 12 and older, pregnant patients, as well as those that are breastfeeding and considering pregnancy. There's a recommendation now for a third dose that's under emergency use authorization, and some people are calling that a booster dose. And then we know that there's rising numbers that are really going beyond what vaccination alone can take care of. So vaccination is super important, but we know that mitigation strategies are also very important. And when we talk about mitigation strategies, we're talking about mask wearing and distancing and things like that. We know that just recently, hot off the press, Pfizer has received the FDA approval for the first COVID-19 vaccination. And then we know that we're learning a little bit more now about the duration of the effect of the mRNA vaccines. You know, I just wanted to remind us of this thing that we're calling COVID-19, and remind us that it's caused by SARS-CoV-2, a respiratory virus. So it affects the respiratory system. And so many of us now have been impacted, our families, loved ones, friends, people that we don't know. We're just seeing the numbers impacting so many people. I wanted to show you that this is something that we still have to be mindful of. This is a map that I grabbed from the CDC website today, and it shows at a glance the community transmission. And it's the transmission is based on, or the colors are based on the level of transmission. Blue is the lowest and red is the highest. And you may think, well, I've escaped. I'm not really affected by this, or COVID-19 is not in my area. But if you look at the map, almost every area is affected by COVID-19, and every area is affected by COVID-19, and almost every area is affected in a very, very high way. We know that the cases in the last 30 days are over 38 million. The deaths are over 620,000. And we know that this high rate of community transmission translates into over 100 cases per 1,000 persons in the last 7 days. It's also considered an area of high transmission if people that are testing positive with the NAAT test during the last 7 days is over 10%. So you can see we're really in a high transmission zone for the most part in the United States. I wanted to bring it down to our level, to think about not only the transmissions, but what's the predominant variant that's being transmitted. And I mentioned that to you earlier, and it's the Delta variant. And we personally live in zone 4. But I just put the map of all the zones across the United States, and that orange bubble represents Delta. And the zone 4, the Delta variant is 98.9% responsible for the disease that we're seeing right now. So that's a pretty big number. And we know that the Delta variant seems to be more infectious and seems to be affecting people differently, affecting young people, causing hospitalizations, still causing deaths. And that's something that we really want to address. We know that when we're talking about older adults, we know that older adults are high risk. 8 out of 10 COVID-19 deaths reported in the United States have been in adults 65 and older. So we have to think about how do we protect our older population, but how do we just protect our population in general? There's a few recommendations from the CDC related to older adults. Getting vaccinated prevents severe illness, prevents hospitalization, and prevents deaths. It's not 100%. It's a vaccine. It's not a cure-all, but it's a preventive measure to help mitigate this pandemic. We also know that for people 65 and older who received both doses of either the Pfizer vaccine or the Moderna vaccines show 94% reduced risk of COVID-19 related hospitalizations. That's a huge number, 94%. And we're learning more as the vaccine's out longer. We get more information and more data about this. And we're seeing that those numbers live and what we call in vivo, like people living, those numbers are a little bit lower than that percent, but still very high as it relates to preventing hospitalizations. We also know that unvaccinated people should get vaccinated and continue to mask until they are fully vaccinated, especially with the Delta variant. It's more urgent than ever. We're talking amongst each other about caregivers and our relationship to our loved ones. And, I just wanted to make sure that we highlight the importance of caregivers and highlight the number of caregivers over the age of 18. It's in the 25% range. This is from data from 2009. We know that caregiving is such a blessing from God. It's such a joy, but it also can take a toll. It can take a toll. It's associated with elevated levels of depression and anxiety. It's associated with higher use of medications that are psychoactive, worsening self-reports of physical health, compromised immune function, and increased risks of early death. And these things are really important for us to mitigate and address. There's some really positive impacts of caregiving, though. A sense of fulfillment, a sense of establishing extended social networks and friends, and feeling needed and useful, and just learning a lot about yourself and about meaning in life. I know as being in a caretaker role before, I've experienced those things. So a few tips for caregivers. I shared this last time, and you know what? I'm like, let me just pull that slide back because I think that that's really important. The thing that I added to the slide is actually vaccination and masks, because as caregivers, we have to protect ourselves so that we can protect those that we love, but then also just for ourselves. You can do that just for you. You have to eat well, be active, take care of yourself, take breaks. And we know that when we don't do these things, they can also be linked to Alzheimer's, and certain things can be linked to Alzheimer's prevention. When we think about taking care of ourselves, we also think about things that are important to our loved ones. And I mentioned earlier the risk of severe illness related to COVID-19 for those that are older. And we know that 6 million adults have some form of dementia and it gets higher as they get older. Some people may be saying, well, when my loved one is experiencing dementia, how will I know to seek care? How am I going to understand those differences, those changes? Well, as caregivers, you know a lot about your loved ones and what their normal state is. But if you notice changes in behavior or worsening symptoms of dementia, perhaps speak to your provider, perhaps get them evaluated for COVID-19, because sometimes that can be associated with COVID-19, as can stress, anxiety, or be associated with stress, anxiety, and other infections. Also, your loved ones, if your loved one has advanced dementia, you may need to be that advocate for that person. I mean, you've been an advocate, but you may need to be that person in person if they're hospitalized. But there's also often safety restrictions where it's limited how you can be in the hospital or if you can be in the hospital. So, to prepare for that, you can come up with a plan, work with the nurses, work with the doctors, and have a communication plan and strategy that makes you feel at peace. What are some of the symptoms that people may experience with COVID-19? So we have all these lists of symptoms, but what we know about people that are older, they may not have a fever, they may not have a cough. They may experience, like I said, increased agitation, confusion, sadness, and some of the other things that are missing listed there. I also just wanted to talk briefly about how there's a difference in race and ethnicity as it relates to infection with COVID-19, hospitalization, and death. And in our last talk, we talked a lot about health equities and inequities and kind of how we needed to be mindful of addressing that. So I just wanted to bring it back up because it's something that we have to keep at the forefront and make sure that we're addressing as a community and individually. We see that American Indian, Alaska Natives are the highest risk for death from COVID-19, followed by Black or African Americans, followed by Hispanic or Latino persons, followed by Black or African Americans, and then Asians compared to white non-Hispanic persons, according to the CDC. Why are these racial inequities present? Why do we see these differences? These are what we call unfair differences or avoidable differences. And this happens because of chronic lack of investment in communities of color. It happens because of modern and also historical injustices and things that continue to be pervasive, like structural racism and policies that really inequitably affect people of color, which leads them to be more likely to live in crowded conditions, work in service jobs, work in jobs where they can't take time off, limited access to quality health care, people having to take public transportation, dealing with pre-existing conditions like high blood pressure, diabetes, and things that increase your risk if you have COVID, as well as lack of health insurance and living in poor areas of high areas of pollution. The question that a lot of people ask, we're talking about older people. I know that caregivers may be in a younger age range. The question is, can younger people get coronavirus? The answer is yes. And this first bullet is from September 2020, one study. But now we know that between the ages of 18 and 49, that makes up the largest group of people that are hospitalized due to COVID-19. And this is just a graph that signifies that from the CDC over the last week. The other thing I wanted to do, though, is, we're people of faith, and I just wanted to encourage you and remind you that even though all of these negative, and I've shared some things that sound very heavy, we know that we have the love of Christ, right? Romans 8:35 and 37 says, "Who shall separate us from the love of Christ? Shall trouble or hardship or persecution or famine or nakedness or danger or sword?" And then it goes on to talk about some more things. It says, "No, in all these things we are more than conquerors through him who loved us." So we know that God loves us, that we're more than conquerors, and he also gives us the opportunity to walk in a place of wisdom and gives us the opportunity to know about prevention. So I'm going to share some quick prevention strategies. You know them already, so I'm going to blast through them. Vaccinations prevent people from dying. They prevent hospitalizations. They do a lot for us. Mask wearing is still very, very important. We're going to need both of those things to really get this pandemic under control. Physical distancing is still important. Avoiding crowds, avoiding poorly ventilated indoor spaces. And I just threw washing hands on there because good hygiene is still important as well. When you look at how many people have been vaccinated to really help us in this effort, 171.8 million people have been fully vaccinated. And I just wanted to show you this number of people over the age of 65 is 81%. We have some work to do as it relates to making sure that all races are vaccinated, African American, that there's no gaps there, but we are seeing some good numbers as it relates overall to people and for people that are over the age of 65. I wanted to point out those over the age of 18 have some work to do. If you're under 65 and over 18, think about getting your vaccine. That number is only 62%. We need to get that number much higher in order to stop this pandemic and prevent people from getting hospitalized. This is local data from Leon County. I just wanted to share this for those of you who might be from that area. And it shows that 86% of people over the age of 65, but not as many people 18 and older total. It's 52.6%. Well, what's new as it relates to the vaccines? You all know about the vaccines, Pfizer, Moderna, J&J or Janssen vaccine. What's new? We know that vaccines are protective against severe disease and from death from the variants. We also know that if you're fully vaccinated, the new recommendation is to still wear a mask if you're indoors in public, if you're in areas of high or substantial transmission, and that there may be some side effects from the vaccine. We don't want to minimize that. That can happen, but they're usually short-lived. They usually go away and don't cause long problems. The other thing on the right side of this is that the FDA has approved its first COVID-19 vaccine. So no longer is Pfizer under emergency use authorization only. It's fully FDA approved for the prevention of COVID-19 in people over the age of 16, okay, for 16 and older, actually. There's still the emergency use authorization for those that are 12 to 15, so for younger people, and also for people getting that third dose who may be immunocompromised. What are some of the risks associated with the vaccine? No, they're few. There's not a lot, but there's a lot of press around them. So I didn't want to ignore it. There's the report around myocarditis or inflammation of the muscle of the heart from the mRNA COVID-19 vaccine for those males, particularly between the ages of 12 and 29. And what they found, though, is that the numbers are small. 40 cases per million cases for second doses. And it just depends on the age, but it shows you that the numbers are small to the point that they still deemed the benefits of the vaccine outweighing the risk of the vaccine. And we'll have to continue to monitor this for sure. Another risk that I just wanted to bring up, and there may be some others that I'm not capturing here, but I wanted to capture the one around the J&J vaccine, the Janssen vaccine, because there was a lot of conversation about thrombosis, reports of thrombosis with what we call thrombocytopenic syndrome, which is a blood clot. It's low platelets, which has to do with how the blood doesn't bleed, how you don't bleed, and it's serious but rare. And they also, so they held it. The CDC and FDA held it for a while, and then realized that it was deemed more that the benefits outweigh the risk about 10 days later, so that's still available. And what we know is that the risk of getting COVID with severe complications is higher than the risk of severe side effects from the vaccine. This is how you can find a vaccine. Go to the vaccines.gov site. If you're in Florida, you can go to floridahealthcovid19.gov. What's the treatment? So we talked a little bit about prevention. The talk today was really about how do we prevent it? And then I want to close with how do we treat it? So treatment of COVID-19 as an outpatient, there's monoclonal antibody. That's something that's new, not really new, but that's something that we have more information about since the last time we spoke. And then lots of supportive care. When you have a virus like the cold or the flu, this isn't like that in the sense of how severe it is, but it's similar in the sense of supportive care, fluids, rest, hydration, those kinds of things. Inpatient really depends on the severity. Could be hydration, could be oxygen, could be antiviral medications, steroids, and then sometimes people have to be on the ventilator, respiratory support, and multi-organ support because death can result from COVID-19. Monoclonal antibody, I just wanted to mention that it's indicated to prevent hospitalization or death in high-risk patients with COVID-19, and it's widely available in the state of Florida, widely available in a lot of places for individuals 12 and older who are high risk. So you have to talk to your doctor about if you're high risk, but access is there. It's not usually charged. There's not a charge for it, and it's for people that aren't hospitalized. So it's for the people that aren't severe to keep you from going into the hospital with COVID-19. I wanted to talk a little bit about vaccine confidence because it's so important. People talk about, I'm hesitant about the vaccine, but how can you be confident about the vaccine? Well, you can be confident knowing that it's a personal decision. Also, we know for sure that COVID-19 vaccination decreases hospitalization, suffering, and death. We know that it's offered at no cost. We know that it's unlikely that you'll see long-term effects from the vaccine, but we need to keep monitoring it over time, the longer that it's out. It's recommended in pregnancy. by ACOG, CDC, and several other groups. We also know that the side effects are usually very mild and short-lived. We also know that if you get COVID-19, you're at risk for spreading it to other people. So you may be like, it's not a big deal for me, which we know it is a big deal for younger people now. But you don't want to spread it to other people. God forbid you spread it to someone and they get sick and die from it. We also know that the booster or third dose may be required depending on how long it's been since you had the last vaccine, and also if you're immunocompromised. We know that there's a monitoring system that we keep sharing information in so that we can monitor the vaccine safety. So that's ongoing. And then lastly, I just want to say a big thank you for allowing me to share. And thanks for all that you're doing as far as being a part of stopping the spread of COVID-19, stopping people being hospitalized from COVID-19, and really taking care of yourself and also taking care of your loved ones. Thank you so much.
Well, that was quite a journey that you went through. I'm so thankful personally, and this is true for others, that we will have a recorded video of your talk, Dr. Joe Brown Spates, after the workshop is over, so we can review it 2 or 3 times. Question for you. This is a personal question. What has it been like as a medical professional navigating the new variant and the spike in cases?
That's an excellent question, and it's definitely a personal question. I realized that on this past weekend, I was on call, and a couple times this last week, actually, and it just really hit me differently than it had before. I actually had a tearful moment. And I think because, being close to someone who has COVID-19 right now, and then seeing patients dealing with COVID-19, hearing them tell me the stories of their family members. I listened to my colleague on yesterday or the day before, just sharing, some of the really sad cases in the hospital, kids dying, pregnant women getting COVID, having to deal with, how do you save the mom and the baby? How do you make those kinds of difficult choices? There's a lot of things going on with COVID that are very heavy for the heart, especially because there's a lot of people that have made this more of a political decision and not so much a public health decision. And it really is a health decision. We're people. We have loved ones that are impacted by this disease, and we have ways to stop it. We have ways to decrease the spread. And then we, have people that are on the front lines over and over and over again, going out, sacrificing themselves, sacrificing their families, if you will, to take care of people with COVID-19. And I think people, we go into this profession because we care about people, but there are people in the hospital, there are people in the emergency department that are taking care of people who maybe didn't get the vaccine. A lot of the people, the majority of the people that are getting hospitalized from COVID-19 didn't get the vaccine. So that shows you that they're taking care of people who might have been able to prevent getting sick and might have been able to prevent, getting other people exposed to it. So there's the scientific part of it, but then there's also the actual heart part of it, right? We do the head and the heart go together, the head and the heart and the hands, and you said you're a servant leader, someone in that servant role, we're happy to serve and take care of people and pray for people, but we also want people to do the things that they need to do. And I believe the Lord gives us wisdom. We can ask for wisdom and he'll give it to us. I believe that we can, seek him and he'll give us guidance, all those different things. I think he gives us tools for health. And so I appreciate you asking that question.
Thank you so much, Dr. Joe.
You're welcome.
Your personal testimony is about your faith and how there really isn't a division in your life between your practice as a physician and your walk with the indwelling spirit. And of course, I know you're the co-senior pastor of University Ministries International. We're so glad that you can bring both the faith and the science components of managing the COVID-19 pandemic to the table tonight with us, and to be able to do so effectively with the persons we call patients and with your faith community. We have another question here from Amanda D. Jackson. Just to clarify, is the vaccine safe to take while pregnant?
Hi, Amanda. Good to see you. Or good to see your question. So listen, the American College of OBGYN, I believe the CDC as well, has basically recommended and strongly recommended that women that are pregnant get the vaccine. And why is this? Why is because we know that people that are pregnant are getting sick from COVID and not doing well. And we can prevent that. We also don't have the data to show that the vaccine has caused harm to women that are pregnant. We don't have the data to show that the vaccine is interrupting fertility. And we really wouldn't know the science behind why that would be the case. And at any rate, and then there's 2 new studies out, and I can't quote them because I haven't read them yet. They're kind of like in the last week, but that are supportive of that same data. That we don't know that it's safe for pregnant women. It's recommended for pregnant women to take it, and that it doesn't cause any problems with fertility.
Thank you so much.
You're welcome.
We're thankful that you're going to be available for panel discussion at the end of our 4th presentation, and I'm sure you'll have many more questions, Dr. Joe. Thank you for a fabulous, inspiring, and informative presentation.
Thank you, Dr. G. I appreciate you.
And now, folks, we have Miss Brenda Franks. Brenda Franks is a dynamic, creative entrepreneur, as well as a dedicated family caregiver. We are so thankful to have you here this evening, Brenda, speaking about your experiences in negotiating the COVID-19 pandemic, your experiences in working with others in the community, family and friends, and bringing to us their impressions of the safety or lack thereof of vaccination.
Thank you, Dr. Glukoff. And I just want to say that was so dynamic, Dr. Joe. Thank you so much for that. My experience has been mainly with the community. I and my family. You know, we have family Zooms where we were all, just trying to stay in touch when COVID first hit and we became very isolated. So on our family Zooms, everyone wanted just to check in, make sure everyone was okay. But oftentimes it interrupted into heated discussions about, have you been vaccinated? Are you going to get vaccinated? Where they are with the vaccination. And I've got to say, I was one of the more reluctant people with the vaccine, receiving the vaccine. My reluctance centered around whether or not it was safe. I listened to the myths, and I'm going to share a couple of the ones that really impacted me. One was that the vaccines hadn't been approved, and they just pulled it out of the air, in order to give people something. It hadn't been tested. It was out there, and, it was developed so quickly that it wasn't safe. So I had to go in and make my own list of pros and cons about these things. And with that one, I really found out that the vaccine had been in the works for years because there were other viruses that I was aware of, the MERS and some of the other things that were already in the community. So it wasn't like people were going from ground zero with the testing. And that made a big impact on me. When I found out about having something for emergency use, and this was an emergency. When you're shut in your house and businesses have closed up in the community, that's an emergency action. So was it an emergency situation? Absolutely. But also now, as we know, at least the Pfizer has gotten the FDA, and I'm sure the others are right behind them. One of the other things that really impacted me was that the vaccines Moderna and Pfizer were going to alter my DNA. And believe me, that was a biggie for me, because while I don't know a whole lot about DNA, I was worried about growing a third eye or another limb or being deformed in some kind of way. And what I did was I waited. I let my brother and my friends go first. And I wanted to see if they were what their reaction was going to be. Were they healthy? Did it change anything major in their life? And I said, I'm going to give this 60 to 90 days, and then I'm going to make a decision about it. So true enough, I watched them and I asked them weekly. I talked to my brother almost every day and asked, how are you feeling? What changes are you seeing? Have your bowels changed? Has your eating habits changed? What changes do you feel like this vaccine has made in your body, in your physiology? And actually speaking, one of the people that I talked to got the Pfizer and one got the Moderna. Both had some mild symptoms on the second shot, but no more than the sniffles for a day or two, and they were fine. But that's to be expected. And I go back to my days as a young mother when my children would get their vaccinations, measles, mumps, rubella. I knew that they were going to be cranky that evening, that maybe the next day I give them a baby aspirin, and make them and do something that was comforting to them. So I could understand why a vaccine would be like that as well. I've taken many vaccines over my lifetime. Yellow fever, I travel internationally. So when I go to another country, I'm taking a vaccine. I'm learning about what it is I need to do to be safe and to stay alive. One of the other myths that I came across was vaccine side effects are worse than COVID. And I've got to say, from what I saw of friends who were on respirators, who were very ill, and I had to quarantine myself last year during the summer, in complete isolation because I had an exposure. I never had the disease, but from the exposure even. But those persons that I saw go into the hospital, every one of them, when they came out, said, I wish I had taken something. I wish there had been something I could have taken, because early on, there was no vaccine to take. So I made the choice to look at what were the side effects. And what I found out was that they were really relatively mild. There was some on-site swelling. There were, it was suggested that women might want to wait a little while to get a mammogram afterwards because your lymph nodes may swell, but that was very temporary. So the next myth was that you're better off getting infected and get some natural immune instead of getting the vaccine. Well, I looked at that, and I looked at what I saw of the people who had been in the hospital with COVID. Even those with mild cases, the congestion, the lack of taste, the lack of smell, being lethargic and not having energy. And I also realized with that it would take a while for natural immunity to build up in the community. So I looked into it and said, okay, maybe I need to look a little further. My other reservation was about that they could make you infertile, or that about the fetus. Well, we just covered that. Not that I'm going to get pregnant at this age, thank God. Those days are long gone for me. Now, and the other thing was, I hear a lot from my friends now, some that did have COVID, that they don't want to get the vaccine because if they get they've already had the disease and they can't get it. And I've learned that that's not necessarily true. Some of the statistics say that it's worse with the Delta variant if you've had it. The other myth that went around a lot was that you should wait. And that was what I was doing. I was waiting on that better vaccine. I was waiting to find out if things were going to just, I wanted to take the one shot instead of having to get two. But I finally decided, and here was my decision maker. My decision maker was, as I said, I'm an event planner. And one of the largest events that we do is an event called the World of Nations. We may see 30, 40,000 people in a day at that event. And we had one of the busiest areas. And yes, we did the event in February of this year. But I planned, in planning the event, we separated each tent out 6 feet apart. We spaced out chairs when we were doing presentations 6 feet apart. We allowed families to cluster. But here's what I noticed. After doing all of that, the public didn't care a great deal about distancing 6 feet apart. Many of them, everyone was required to wear a mask when they came in. It's an outdoor event in a festival field, but many of them took off the mask after they got in. I can't police people and make them put on their masks. That's beyond the scope of what I could personally do. That made me realize, because at that point, I did not have a vaccine. And I said, if I am going to have any measure of social life, professional life outside of the COVID, then I need to get a vaccination. That was my major determining factor, because I knew I could not control anyone but myself. Now, the other thing is that I've been a part of the ACTS program full cycle, as I call it. I was a caregiver for my mother and for a cousin. Both of them were professional women. But I have to say, one of the things that they always asked us to do was, one, to look at the facts. My mother was an educator, so she was get the book, get the facts, and look at them. Look at who's giving you the facts. Are they credible people? Or is this based on something else that you may not even know anything about? So I had to really look into that. And I got the information about the DNA from a doctor who was into DNA research. So having them explain to me how the vaccines are being developed, how long they've been in development, what other places had already utilized that type of information was critical and correct. The other thing that I had to look at was layers of protection. And for me, there are many layers of protection with this. There's the masking, which I was doing. There was the hand washing. I washed my hands so much they looked like chicken feet. And some of you saw my Facebook post, and I know you're chuckling right now. But, you know, limiting my exposure to other people. I was going into the stores if I had to make an in-person stop early in the morning. I was wiping off groceries coming in. But the major thing was the vaccine. It gave me the best chance of survival. And I look at it as kind of like a car. If you're in an accident, if you have on a seatbelt and if you don't have on a seatbelt, and that's the way I look at the vaccine. If you don't have on a seatbelt, you might go through the windshield. But if you have on the seatbelt, you might be bruised on the shoulder. You might have some whiplash from going back and forth. But you probably won't have the injuries that a person had going through the windshield. Those were the things that helped me make the decision to get a vaccine. But I also have to say that it is an individual decision. So when we would have those heated family discussions and people would team up on other family members who may not have had a vaccine, I had to say, stop. They have to make the choice for themselves because that is the right thing to do. I want to thank you for listening and for including me in this discussion. I hope what I've said will help you make your own list of pros and cons and do your own research to make the best decision to live your life joyously.
Thank you so much, Miss Brenda Franks. That was a very thoughtful presentation, particularly impressed with how systematic you are in not only thinking through the issue around myths or possible truths that need verification, as well as your listing of the pros and cons of vaccination yourself. Question for you. What would you say to a caregiver of a loved one with dementia when she may be somewhat reluctant to bring her mom to the doctor for vaccination?
I would say to think about how and why, what is the reluctance based on? To really examine that. Is it based on your fear of what will happen when you get to the office? What is it based on? What is your reluctance based on? Is it based on the fact that you think that your mother may get sicker, or that it may cause her some harm? And I would ask, how would you handle it if you didn't and she got COVID? And that was real life because, during the time when COVID started, I was still in some of the facilitation workshops with my group about COVID and having to explain it to their parents, or the one that they were caring for, or having other people come into the household. It's not a light decision, but through communication, you can have that discussion and come up with an effective decision and discuss it with the doctor about your reservations.
Amen. Yeah, I asked you that question because this is not theoretical for you, because you have been a care partner for your mom and another member in the family. So I'm sure that you have given this question some thought, not only for the care partners with whom you worked in Acts 2, but also maybe reflecting on what would you have done yourself.
Absolutely. And many of my extended family have called and said, how do I talk to mom about getting this vaccine? She's afraid. What can I say to her to help her? And I said, well, first of all, start with a prayer and ask about her faith. And did she get you vaccinated as a child? It's kind of like one of those commercials where, it's good for you, and going back to that, this is good for you and this is going to help us all, and maybe doing it together where both of you are vaccinated at the same time.
Yeah. Well, I know that Dr. Joe Brown Spates had an affirmation that was put up. Excellent presentation, especially around myths and your personal experience. Well, thank you so much. Once again, great advice. Start with a prayer.
Yes.
We look forward to the panel discussion. Brenda, I'm sure that there will be others in the audience who are care partners themselves who will be asking for your opinions, your advice, and drawing from your wisdom. That's quite transparent in the presentation tonight. Amazing. Thank you.
You're welcome. Thank you.
And now we have Mrs. Lisa Bretz. Lisa is the Executive Director of Advantage Aging Solutions. First, Lisa, I want to thank you for returning to the Facebook Live, Acts 2 Facebook Live workshop series. Last time you spoke, you addressed the issue of federal and state services for older adults with dementia and their loved ones, their care partners. I know this evening you have a slightly different focus, but you do have the bigger picture, both for the Leon County and 14 county area, 13 counties surrounding it, but also as the vice chair of the state area agencies on aging. So thank you so much for returning and look forward to your presentation.
Great. Thank you so much for having me back. I am pleased to join you tonight. So I wanted to take the opportunity to share with you a statewide communications campaign that my agency and my counterparts around the state are involved in. It's We'll Meet You at Home. It's a campaign that was started by the Department of Elder Affairs, which is give credit for the financial support that they provide for area agencies on aging and the Aging Network in Florida to provide those direct services to older adults. On average, our agency alone is helping to keep over 9,000 seniors in their homes because of the programs that we operate. We wanted to make sure that this is not about coercion. Ms. Frinks did a fantastic job of breaking down the myths, so I don't need to do that for you. I think she did a great job. Though I am right on point with everything that she shared with you. But the goal here is not to coerce you or convince you to get the vaccine. We do want to be sure, though, that you're able to make informed decisions on whether the vaccine is something that you want to pursue or not. And I thank you also to Dr. Speights for, she did a fantastic, she laid out the facts that you heard from a medical professional, you heard from a caregiver and a community professional. We want to be sure that individuals know that the vaccine is available free of charge throughout, our state. We have multiple points of access to obtain the vaccine. But one of the greater concerns that we have is perhaps people are homebound, and that includes the caregiver and the one that they're taking care of at home. Fear of catching COVID and what it's going to do to the ones you're caring for and the family around you. We have learned that the Department of Health has been very responsive. Health professionals around the state have been extremely responsive. And we are able, through the Area Agency on Aging and our network of service providers, to help coordinate the shots at home. We can help coordinate those home visits. So we're back to old school, where the healthcare professional comes to visit you and provides the vaccine to you in the comfort of your own home. We are all practicing those universal precautions, washing our hands, wearing the masks. Healthcare professionals go even further with the lab coat protection and the gloves. We have seen great success around the state by having the healthcare professionals be able to come to you. We wanted to share with you that we can help you access the vaccine by helping you identify where the vaccine locations are in your community. We can help coordinate transportation through our service providers. Here in Leon County, Elder Care Services is our lead agency. They and our 13 other partner agencies have all conducted call downs of their client enrollment and waitlist individuals to find out, how are you doing? Can we help you access the vaccine? Trying to allay some of the fears and those myths that Ms. Frinks spoke about. But they are our day-to-day boots on the ground. They don't just provide transportation, they provide in-home services. And in-home services have been severely impacted because people are fearful of having outsiders come into their home. So again, it comes down to, we encourage you to educate yourself. And yes, it's not about the politics, it's about the personal choice. And a thing that I would share with caregivers is communication, open communication. What if you didn't get the vaccine and the one you're caring for catches the virus? Who's going to take care of your loved one? Who's going to take care of you? When you're going to need the support as well. So we just really need to encourage open dialogue, honest, heartfelt conversation. Everybody has an opinion on everything, and that's fine. We can still get along and agree to disagree, but we want to make informed decisions. Listen to your healthcare professionals. Listen to the CDC. Listen to your local Department of Health officials. Those are the people that we recommend you go to for your fact-based information. But we want to make sure that the message that you hear tonight is, if you are interested in receiving the vaccine, again, free of charge, and you need help accessing it, please give us a call. We have the Elder Helpline that we can go ahead and put up here. The Elder Helpline is a statewide toll-free phone number. So you can dial 1-800-963-5337. You'll get connected to either my organization or the nearest area agency on aging to your vicinity. It's a smart number, so it knows where you're calling from, and get connected to an organization that can help link you to those vaccine shots or sites, rather, help you with transportation, or help bring a healthcare professional to you. We can help you book. There's online booking. I know that I will tell you myself, I'm not the most technologically savvy individual you'll ever meet, but our staff and around the state, information referral specialists are on hand to help you go through that system, the online system. We'll navigate it for you. If you don't have access to a computer, or you just aren't tech savvy like me, we'll help you navigate through the system and coordinate those appointments for you. And then, why is the Area Agency on Aging providing you this information? I just wanted to share with you what Advantage Aging Solutions is all about. We serve as a starting point for information and referral for older adults, persons with disabilities, and caregivers who are seeking access and assistance to programs and services. One of the most important programs that we're able to help connect individuals to is the statewide Medicaid managed long-term care program. We are the only entity, we and my 10 counterparts around the state are the only entry point into accessing this program. We'll help you navigate long-term care options. And yes, there's waiting lists, but if you don't get on the waiting list, your name will never get called. So we encourage you to contact the Elder Helpline, not just for the vaccine, but if you have any questions or need assistance caring for yourself as an older individual or helping you as a caregiver receive the supportive services to care for your loved one, you can just call us again. It's 1-800-963-5337. So we hope that we can help connect you to vaccine sites. We hope that we can answer your questions you have, and just navigate the variety of programs that are out there to help support your needs.
Thank you so much, Lisa Bretz. I'm very impressed with your personal level of commitment to increasing access to vaccines, and at the same time respecting the rights of persons to refuse. We do have a question from Tina Johnson. Reason, providing vaccines to homebound is a huge benefit. Or actually, this is a statement. Mm-hmm. Providing vaccines to homebound seniors is a huge benefit, especially to the rural community. Your thoughts about Ms. Johnson-Reason's affirmation?
You know, one of the greatest challenges that individuals have as they age is they give up their right to drive, and access to transportation options in rural communities are very, very small, limited, and almost non-existent. Here in Leon County, it's wonderful. We have a bus system that does go out to our county or our city limits. Beyond that, it's going to be a coordinated transportation provider. We have a great transportation provider here in Leon County through Big Bend Transit and Star Metro. We have those resources, but they're fares for those rides. And we can talk anywhere upwards of $15 per trip. A trip is one way. So you're going to get on the transportation, get taken to the site that you're looking for, your doctor's appointments, and then pay that fee to get back. And when you're living on a limited income, that's a great deal of money. So beyond even the vaccine, we have older adults that are not making it to doctor's appointments. They're not checking on their chronic health conditions. My assurance to you is we have a great network of providers that can help you get where you need to go to take care of yourself. And so the rural factor is a real daily challenge, and other factors that affect older adults as they age in place at home.
Thank you so much, Lisa. Just a quickie question. How do you ensure the safety of healthcare providers when they're coming into the home giving vaccinations?
So when they're coming into the home, they're already very well prepared. It's coming into the home where maybe safe practices aren't being taken care of. I assure you, people are washing their hands more regularly than they ever did. People are wearing masks. You see people driving down the road that are wearing masks. So I think the risks as we knew them when the first outbreak of COVID occurred have lessened as we've learned what types of protections we need to have in place, whether we're greeting people in our home or we're engaging with people in the community. It's very safe.
Thank you so much. Well, moving on now to Tamika Norton-Brown, who's going to be our fourth presenter. Thanks so much, Lisa, for an outstanding presentation. And now we have Tamika Norton-Brown, Acts 2 Project Coordinator. Welcome, T.
Thanks, Dr. G. What I'm going to do is to give information on our X2 program. I know that we talked a lot about COVID and prevention and steps to take, but one of the things caregivers need to also be mindful of is that there are still resources. In addition to the resources that Lisa mentioned, there are resources that are available to assist you. Acts 2 is a free faith-based, which means that we've woven elements of prayer, meditation, and faith sharing into our sessions. But even though we are faith-based, we are also ecumenical, which means that we're open to everyone. Our 12-session program is for African American caregivers, but any person who contacts us, we will refer to other community resources. I will also add that to qualify for our 12-session program, you need to be a relative caregiver, and we loosely define relative. So if you're caring for a neighbor that you love as your aunt, if you consider that person to be your aunt, then we consider that person to be your aunt. You need to spend 6 hours a week in caregiving duties. That does not mean the person has to be in the home with you. If you're providing meals, making appointments, going by, checking up on, we count all of that as caregiving duties. And you have to be experiencing distress from your caregiving duties. And there's a measure that we use to determine that. Next slide, please. Okay, our X2 project serves all of Florida, and we have 3 primary objectives. The first is just to optimize access, uptake, and effectiveness of faith-based skills training and support for those distressed African American caregivers of older adults with dementia. Second is things like this, where we want to increase dementia awareness and knowledge through presentations or workshops at faith community and elder care venues, as well as through print and social media. And third is to provide brief telephone-based consultation and referral services to those African American caregivers and other community stakeholders. Next slide, please. I'm now going to give a description of our actual 12-session program. Our program includes 7 group skills building sessions and 5 individual sessions. There are 3 persons, 3 caregivers per group, and 1 group facilitator. We call them lay pastoral care facilitators, which are basically persons from the faith community who have either been nominated by the adjudicatory leaders or who they've seen a presentation or heard about Acts 2 and have said that they're interested in serving as a group facilitator, and we train them to actually deliver the 12-session program. All of our sessions are delivered weekly over a toll-free telephone system. So when we say it's free to participate in our program, we mean it is absolutely free to participate. We use a toll-free teleconferencing system, and we provide all of the materials. The individual sessions, those 5 individual sessions with the facilitator, will focus on any goal setting or problem solving that the caregiver brings to the table. Typically, most caregivers come in with 2 or 3 things that they want to address, and they get 5 weeks of one-on-one individual attention with that facilitator where they're able to work on those goals. And that's very important because for a lot of the caregivers, this is the first time they've been asked what's important to them. So just having that dedicated time where they are able to focus on what's important to them is very important. Next slide, please. Our program consists of 6 major components. The first is what I refer to as Dementia 101. It is the overview of the basic characteristics of dementias. We have relaxation training that's combined with prayer and meditation. There's this entire myth that relaxing is just going home, kicking off your shoes, and getting into your favorite chair, when in actuality, there's an entire process of having your mind, body, and spirit enter into relaxation, and we train our caregivers on being able to actually relax. There is effective thinking, which is just changing the way that you think about the challenges of caregiving, and we couple that with scripture. Next slide, please. We have one of my favorite, but one of the ones that's hardest for me to do. Building in pleasant daily activities as a guard against emotional distress. I like to refer to this as the me time module. Just negotiating being able to get 15 minutes to take a walk or to listen to some gospel music. We also have effective communication, helping our caregivers know how to communicate effectively with not only their loved one with dementia, but their family and health professionals. And then we also have the developing effective problem solving skills through the personal goal settings. I'm sorry. Next slide, please. Here are some dementia care resources. There's the Alzheimer's Association, the Alzheimer's Foundation of America, the Florida Department of Elder Affairs, the Elder Helpline, the Elder Care Locator, and the Alzheimer's Disease Education and Referral Center. Next slide, please. And how can caregivers contact the Acts 2 Project? There are a couple of ways to contact us. We have a toll-free number, 1-866-778-2724. My local Tallahassee cell phone number, 850-274-4945. And that 800 number does roll to my cell phone. So for any out-of-towners, please feel free to use the toll-free and I will still get the call. My email address, tnnorton@fsu.edu, or you can contact us here on our Facebook page, the Acts 2 Caregiver Project. You can feel free to leave a message. We do respond, and we try to interact with those messages that are on our website. So if you have any questions about our program or resources that are available to you, please do not hesitate to reach out and we will do all that we can to assist you. The last thing that we're going to do is we're going to bring everyone back up for a panel discussion. And so we encourage you to please ask any questions that you have. Please make any comments that you would like to make. We want to have an open discussion. Thank you so much.
Thank you so much, Tamika. And now we have the panel back, and we would really appreciate your comments and questions. If you do have a comment to share with us or any questions, please do so. Otherwise, I will ask a few questions, or panel members can ask questions of one another. Here's an affirmation for Dr. Joe. This was very helpful in decision making and educating myself and my family.
Great.
Thank you so much, Amanda Jackson. Dale Meter said, great information. Thank you, panelists. Jane Springer.
Yay, Jane.
It's good to see your picture and your comments. So much good updated information. Thank you. And thank you, Jane, for sharing with us. And Gregory Speights, I believe he is known to certain members on this committee, co-senior pastor and spouse with Dr. Joe Brown Spates. Awesome info. Thank you, Pastor Gregory.
Working on his brownie points. Good job.
It's working.
Yes, yes.
Here's a comment from Patricia Patterson. Florida, the #1 retiree state, is also a big COVID hotspot. Have the state disaggregated population segments to determine which group is the largest? Has the state taken apart the various sectors of the population to determine which group is the largest unvaccinated? And then she gave some examples: seniors, migrants, minorities, young whites. Question for you, Dr. Joe.
Sure. And Ms. Bretz, I don't know if you have some comments on that as well. So we have some overall data. We have some of the data actually from outside of the state. The CDC keeps a lot of this information, and I'll try to chat it. There's a website that really has, and it shows like, you know, vaccination rates by county. I'm not sure how granular you can get as far as like migrants or you know, like the age and the race or ethnicity, because some of that data is a little bit limited. That data is out there. It's not public any longer in the state of Florida, as I understand. You may know that we had that big COVID, it was like a data tracker website that's no longer available, but you can get overall data. So you can get big data. You don't get the data that's parsed out by race, ethnicity right now, but that data is out there. And some of the data that we can get a little bit more granular through actually the CDC site. So I'll try to put that on Facebook.
And just to add to that, the Department of Health, Florida's Department of Health, do they break down by county, older versus younger, I think is how I saw those two break down. And you covered those statistics very well tonight, but you can find that for each county.
Lisa Bretz, question for you, or just your musings on this question. Could you put back the question for Mrs. Patterson? Thank you. The question is, will the governor and advisory team encourage the group or these groups that may be at greater risk to get vaccinated?
You know, I think the governor's very clear on his messaging. The vaccines are available for, I want to clarify with the doctor, 12 and up?
Yes, so for emergency use authorization, Pfizer specifically is available for 12 and up. And then for full FDA approval, it's 16 and older.
Yeah. So, you know, I will say, because of the professional network that I'm in, of course, I was very delighted that seniors were first after your frontline health workers when the vaccines first became available. And he is circling back to remind us all that we have access. The vaccine is free. I mean, we still have the free testing sites. So I think that yes, as we get down, you know, to identify particular pockets of people in need, those are great message points for the governor and the advisory team. So I don't believe that COVID's going away anytime soon. My concern as a citizen is these variants that we just have no control over. And I do want to say something about vaccines. I found interesting. I saw the other day, it was showing how long it takes vaccines, once a condition's identified, how long it might take to develop a vaccine. And yes, this one was on a very fast track. However, when I was an infant, I contracted measles. The vaccine was available when I was an infant. So just to keep things into perspective, you know, I still experienced the disease. They had treatments available for me by that point, but our immunities, just, you know, we don't know until we face something like this, how our bodies are going to react.
Thank you so much. From here we have another question from the thoughtful Tina Johnson Reason.
Good question.
Has a study been conducted regarding how COVID is affecting those living with sickle cell? Dr. Joe or others?
So, where's my thing? Okay, sorry. So I have not read the study as yet. There's a study that finds that people with sickle cell disease who've developed coronavirus have high rates of hospitalization, intensive care, unit admissions, and death. And this was a study by the Medical College of Wisconsin, Secure Sickle Cell Disease Registry, which captures information, and it looked from March 20. It was back in 2020. So I can't give you like all the details about it, but I do know that, you know, when you look at the new emergency use authorization for those recommended as high risk with COVID-19 or getting COVID-19, patients with sickle cell disease are on that list.
Thank you. Other questions? It's from Dr. Doris Richard. She said she's joining late, but as usual, great discussion. Thank you, Dr. Richard. We're so pleased that you were able to join us this evening. Carolyn Rhines, great presentation, very enjoyable. Thank you, Carolyn.
Thank you. Yes.
Tina Johnson Reason, good stuff. I'd agree with that. Thank you for all sharing your expertise and thoughtfulness. I have a question. Oh, well, here's another one from Dr. Richard.
Yeah.
Did you all share that the Delta variant is one of 8 variants?
So great comment. I did not talk about all the different variants because one, just because of time, but then also, it opens up such a can for people, this whole thing about variants. Viruses variate. That's not really a word, but viruses mutate. So they change, and variations are not uncommon. And that's one of the big pushes around vaccination and actually trying to stop the spread, so that the variation can slow down, so the mutation can slow down, and we can get sort of control over it. But yes, we have alpha, beta, gamma, delta. There's one, I think it's iota. I mean, I don't remember the last year. I have to get me reacquainted with the Greek alphabet. But yeah, there's several variants. But we do know, I think I did show the slide earlier about the 9 or 8 or 6. I mean, it's over 98% of the, especially in this region 4, of the infections are the Delta variant right now. Very small of the other ones.
Thank you.
A really great point.
Thank you, Dr. Richard. Also, I just wanted to let you know that the recording of this video presentation will be available shortly after we finish our panel discussion. And you'll be able to listen to Dr. Joe's presentation, which was the first presentation in its entirety along with Brenda Franks, Lisa Bretz's, and Tamika's presentation. I wanted to ask before we move on to saying maybe our final thoughts and comments. Miss Brenda Franks, you were talking, and I thought this was particularly poignant, about heated discussions, which I think is, it's so good that you brought up that point, because sometimes it's so difficult to enter into discussions where there are very, very contrasting views, people using different sources of information to bring various assertions or statements about risk to the table. What are your thoughts about negotiating those discussions for the caregivers in place who may have family members who may have very differing opinions about the importance of vaccination and the use of precautionary measures, even something as simple as a facial mask or a facial covering?
Great question. In our family, we have, I would say, probably about every 2 months, these Zoom meetings. And it's just a point to check and see what's going on. Now, I think for caregivers, I think once again, for me, going back to that point of what are the pros and what are the cons, and listing those out, and nothing should be taken off of the table. Really listening to people who have differing points of view about why they aren't, because in our family, there was one of the people was a doctor, and he was not getting the vaccination, and his point was, I'm not sure what's in it, and I it's not FDA approved. And while I can respect that as a medical professional, I have to ask you, what are you telling your patients? What are you saying to your patients at the same time? How can, there seems to be this dialogue of, are you telling your patients they should not get it? And if one of your patients come, are you going to try and talk them out of it? So really just trying to understand and listen to the people who have differing points of view and be respectful of that. And if you can show them or give them information, and like I said, sometimes it's just that it's not going to be a win today. That you have to give people a chance to make their own discovery. And a lot of times that discovery doesn't take long, and share little bits at a time.
Yeah, thank you so much, Brenda Franks. I would like to, I know we're going longer than we anticipated. However, no surprise, this is a very emotional and important topic. But I would be remiss if I didn't touch base with my dear sister in the Lord, Tamika Norton-Brown. Tamika, your thoughts about issues related to COVID in the community, in your community. What are some of the issues that you feel are coming to the table that are most important for caregivers to ponder, to consider in caring for their loved ones with dementia?
Just speaking from my own personal experience, I have an uncle who passed away during this COVID pandemic, and I had to set very hard and fast rules for family members, for his friends who wanted to come by and visit toward the end. I respect the fact that, and even these same rules apply for my own household. I respect the fact that if you choose not to get vaccinated, that's your choice. That's your right to make. But what you don't have is the right to put me or my family or the community at large in danger. That's what you don't have the right to do. And so I'm a person with pre-existing conditions. I'm a person who has multiple other, health issues, and I will protect me and mine at all costs. If the least you can do is when you're around other people, and I get even in grocery stores, and I'm always kind of watching and observing people. And I saw a lady in the store yesterday, and she was with her loved one. And I know these people, and I know that the mom has dementia, and she was trying very hard to kind of keep her separated from other people because mom was having difficulty with keeping the mask on, but there were other people around who just were not masked. And I'm of the mindset of, am I my brother's keeper? Absolutely, I am. And so if I can help it by just putting a piece of fabric over my mouth, be inconvenienced. I have family members who are still unvaccinated, who are still talking about it's so hot to be in a mask. And so my thing to them is take the 15 minutes of discomfort of wearing a mask as opposed to being in a hospital on a ventilator and not able to breathe for yourself. I mean, because that's what it's come down to. That is what we are basically choosing between. And it would be selfish of me to put anybody else at risk. What I do in the privacy of my own home is my business. But when it comes down to being out amongst people, you don't know what conditions people have. You don't know what these caregivers are dealing with. I mean, just on a basic level, they've been in the house for almost, over a year and a half now. Mm-hmm. We have the liberty to come and go as we please. But if you have a caregiver who they don't have those options, they're stuck there in the house. So we have to be vigilant. We have to care enough about other people to want to do the very best that we can so that we can all get outside and let outside be opened again. So that's just what I've experienced and some of the things that I've talked about with caregivers as we've spoken.
Wow. Well, thank you so much, Tamika Norton-Brown. I did have the intuition that you had something to bring to the table here. Folks, I think this is a time for one final thought. Thank you for putting that banner, Chrissy, here. Very timely. One final thought. We'll start with Lisa Bretz.
Just remember that we'll meet you at home if you need help accessing the vaccine one way or the other, whether getting to a site or having someone come to you. Give us a call at the Elder Helpline.
Dr. Joe Brown Spates.
Thank you, Dr. Glukoff. Thanks again for allowing me to be here. And I also just feel like Ms. Brown's comments were a good summary, but I will just add to that to say, I think it's a walk of faith and a walk of love. So you have to have faith in God, as far as, making the decision about the vaccine, how you're proceeding in life. You have to acknowledge him in all of your ways. He'll give you direction in what you should do. But you also have to think about it as a walk of love, not just, you have to be kind of selfless in this situation to be willing to wear a mask, be willing to get vaccinated, to protect your brother, to be your brother's keeper, to be your sister's keeper. So I would just encourage people to look at it that way. And like I said, I just want to echo her comments because I think they were really well stated. Thank you.
Thank you. Putting faith into action. I think we're called to do that, I believe. Let's hear from Tamika Norton-Brown. Final thought.
I would just encourage people to take advantage of resources. As Lisa has said, there are people that will come out to your house to get you vaccinated, or even if you have questions about the vaccination, just get as much information as you can and take advantage of the resources that are there for you.
And dear Miss Franks, please, Brenda, let's hear your final thought.
One, I'm very honored to be among this group of people sharing information. I think so much about the world on a global scale and what we have here in the US and right at our fingertips. And one of the things I think about is what Tamika said, is about this shared space, how we can coexist with each other. It's our responsibility to help our community in whatever way we can. And even if it's not with a vaccine, it's about helping everyone to understand that we have to care for each other. That's the greatest love that we can give, is really caring for each other as we care for ourselves. Thank you.
Wow, thank you. Wow, I don't know about you folks who are listening, but I'm deeply moved by the discussions, presentations that we've had this evening. Just encourage you folks to please follow us on Acts 2 Caregiver, our project Facebook website. Our next workshop will focus on the role of clergy in advocating for the needs of persons with dementia and their care partners in the faith community. We soon will announce the date for this workshop in our Acts 2 Caregiver Project Facebook website. Thank you so much, folks. What a great blessing, panel. What a great blessing to have such an engaged audience. And what a great blessing to have such a loving God who cares for us and provides the resources to do this kind of outreach. Special thanks also to Chrissy Souders behind the scene and Melissa Powell, who helped to produce this program. We are grateful to both of you. Have a very blessed evening.